It happened very early in my career, right after my training, and that had to do with my own spiritual practice, and which had really, I had come to a turning point within my own practice, and it was just revelatory that the current model is not how I wanted to live, not how I wanted to serve, how I wanted to practice medicine. So it changed right away, right after training, where I felt like a huge piece was missing from my training, where I wasn't really taught how to connect, because that's something I kind of fell into through my spiritual practice, and accidentally, I should say, because it's not really taught in our training. And then I could no longer follow the traditional model. So I was very fortunate that I had, a parallel life where I was very deeply into spiritual practice and meditation and contemplative practices and ancient teachings and so on. So I was very fortunate that I had that, which opened me to another dimension of reality, which and it was no longer enough to talk to patients about their health without talking about this aspect, this deeper aspect, because then I felt like I wasn't really, it was a disservice when I was excluding large parts of them and only giving prescriptions and treating one little organ, the heart, rather than talking about the heart, the big heart. So, my field, cardiology, is really a field that is fueled by type A personalities. It attracts a certain, kind of person who is willing to do whatever. Right? And I think that's what makes us really good doctors as well. But however, it comes at a cost. And in my long years of work and practice, I have seen colleagues who were, these ruthless go-getters become soft with life experience and from having children or grandchildren, and something moving them to a point where suddenly they wake up. It's like one day they're one way, and then the next day something has shifted in them because they have been given this front row seat to the beauty, the unbelievable beauty of life. Or it can be a patient interaction, something that moves them permanently. And I have seen this again and again throughout my career, where people that I thought would never change have changed. And this is not just my colleagues, but even patients, where I felt like, okay, this is as far as this person is going to go, and then they come back 3 months later and they are different. And so it's so humbling, and because of its unpredictability, that because life always does what she's going to do. When you're talking to somebody, and I have seen this, and I think I have some explanations for it. When you are talking to somebody, and everybody experiences this, in certain interactions, there is a immediate or there is a gradual coherence, where what you're saying and what I'm saying and what you're listening to, it becomes part of one. The otherness of the other person goes away. And in those moments, I can notice that our breaths are synced up. And when I check heartbeats, they're the same. It has happened many times. And that is when I know that what ever I'm going to recommend, it's going to be done. It's not just trust. It's that connection I was talking about earlier, where you have become one. You have become one at a very deep level, where there is not just trust. There is mutual trust, of course, but it's more than that. It's like you have the walls between us have dissolved, where even our breaths and our heartbeats have synced up. And you know, there have been studies looking at this coherence, the electromagnetic waves from our bodies, they just kind of merge and start to act as if they're one, right? And we notice this in intimate relationships. But that is possible also in a doctor-patient relationship. And it's not special to me. I know many physicians feel this. It's just that they may not be aware of what is happening. Why it is that certain times you connect with a patient at such a deep level that whatever you're saying, whatever they're saying, it's all, kind of merging into the lack of a problem. That's what it is. So when that is happening, and I tell a patient, listen, you need to change your diet, I know without a doubt they will. But when there is no coherence, when that's not happening, they will require many, many, many reminders. I mean, this is one big deal, right? Coherence is a big deal. It is because, and they feel it. I've had patients tell me, I don't know what happened the last time I talked to you, something happened to me. And it's not me. It has nothing to do with me. It's just that we both were aware that something was going on that day. That was beyond what is ordinary or human. That cannot be explained by studies, by anything. It's mystical. And those mystical things are really commonplace. When you work on yourself and you become more and more aware of this interconnectedness between yourself and everybody, that just happens all the time. It happens all the time. You're just constantly aware that you're connecting with somebody at a deep level where, our interaction becomes sacred. Every interaction is sacred, of course, but we are aware of that sanctity and the beauty and the sweetness and the absolute mind-blowing, the mind-blowing awesomeness of being in connection with another human being.
And what in our medical world right now, doctors and physicians focus more on the result of the chemical or mechanical movements of the body. So what is the things produce that mechanical and medical result? I think that is very important. So that is the heart, that is the mind, that is the qi in the environment. So as a doctor, when you quiet your mind down, you drop your shoulders when you see your client and relax, put a smile on your face and listen to your client. Take that couple minutes to listen to your client. And then you ask your heart to help you to find, among all the symptoms your clients give to you, right? You find the root cause of that challenge of this person. This person might say, I have headaches, I have ringing in my ears, and my eyes kind of get dry, and my heartbeat is racing 2,000 miles an hour, and etc. So then what is the main cause of all these symptoms? You ask your heart, and your heart will direct you to push the right button. Then you are able to get a more accurate diagnosis, and you can give a better prescription for your client. And that's what I do as a Qigong healer. and a Qigong master. When I help my clients to heal their challenges, sending energy, and also I listen to them, and then I listen to my heart. I use the techniques I share with the people to find out energy blockages, the qi blockages inside the body, so that I can go directly to that part of the body to heal. Like for instance, one time when I saw a client, and a Qigong student, and who had been coughing for 6 years, chronic coughing, and examinations showed nothing wrong with the body, but he just had this cough forever. And he came, he said, I have a dry throat, and the chest is kind of tight, and the back, and the shoulders, and many symptoms. Then after I connect him, and I went to my heart to ask me to direct where I should treat the body. So I found out he had blockages in the kidneys. And now, so I cleared the kidney energy channels. Just within a few sessions, he was completely healed. And of course, I showed him a couple of movements, Qigong movements he practiced, after he saw me. So that is a very quick and accurate reading of the energy in the body to get the qi flow again.
You know, the studies are showing that physicians and healthcare providers are really highly stressed. And when you're highly stressed already, you're not going to be providing a place where a person feels the center of attention. They need to feel connection. There's a magic we can learn from parents. If your child is crying, if you can feel a sense of empathy for the child and feel their pain, a power happens. The child feels better right away. But the child also feels better, one, that they had got an opportunity to express. Two, is that there was a validation and that you can relate in some way to their fear, to their hurt, to their sadness, to their anger. There's no trying to change how they feel, but actually a support that acknowledges it. Even if they're feeling sorry for themselves, you can feel the emotion of fear or the emotion of sadness. You connect with that, but you put it in a space. The context is compassion, which is, it's not such a bad thing. It's a tragedy. I mean, we see tragedies all the time. At the same time, a bigger belief needs to be there, which is that we learn from our suffering. We learn from our pain. And we can learn better and grow through it faster if somebody is there to help us. And the way you help, it primarily is with your skill and your technology and your analysis, providing a service. But prior to that, another help that people get is feeling the connection, that they're not alone. Because ultimately we now know that most illness and sickness, not all, but most, comes from a place of stress. And we are stressed when we feel we have to do it all ourselves, when we feel that we're isolated, when we feel alone, when we feel disconnected. And so when someone goes to see a doctor, they're opening their heart up saying, I'm allowing you to give direction to me. First thing to do is not to quickly give solutions. I want to give one example of that. My daughter, one of my daughters, around 8th grade, I used to do all her homework. She felt she couldn't do math, and eventually she became the highest scoring calculus student in her university. Part of that was because Dad every night did her homework with her, and pretty much I did it, but she watched how I did it. And about 8th grade, it was getting pretty tough. I'd have to read the chapter of the math to do the answers, you know, to be reminded of the formulas and so forth. So my brother happened to be visiting, her uncle's my brother, and I said, oh, he's a math PhD, he can come help you. And so he said, okay, what's the problem? And so we saw the problem, and his reaction was, oh, that's easy, no problem. And immediately my daughter felt insulted, because from her side, well, if it's so easy for you, I must be so stupid. That's called validation, the opposite of validation. So if somebody's in pain or afraid or upset, don't be so quick to give them the reassurance of, no problem, we can handle this, we can fix it. There's a place for that if it's appropriate. But the first thing is to listen and to validate, to let them know that they're not alone in this, they're not stupid for feeling this. Then you can provide your expertise.
Well, I mean, I think that this is process of people waking up, and people are talking about this, and it's in books, and what does that ultimately mean? And I think that our awareness of the world and the 3D world around us, and our awareness of self, and our connection to the rest of the world and the universe is moving into a whole new realm that's really unknown to many people. And I think when we connect to our heart, we have some tools to do that using heart math. And as I've been teaching people who have been coming to my clinic how to connect to their heart, how to become more self-aware in doing these breathing practices and shifting to this more sort of regenerative emotional state rather than getting stuck in frustration and anger and anxiety, that they're coming back to my clinic a week later, and I've had patients say, I'm waking up. Like, I don't even know what happened, but I see things differently, I feel different, my whole perspective has changed. And that is so amazing because, and in that awakening, in that perceptive change, they get better, right? And it's not anything I've done. All I've done is guided them to their heart. And they've done all the work from there. And I think the heart, not to sound too woo-woo or spiritual, but the heart really, it's like this wormhole to our spiritual selves. And there's energetic explanations for that, and I think it's still very much esoteric. But if you just buy that piece of the heart being this window, right? We call it the window to the soul. It's a little woo-woo in Western medicine, but in so many other civilizations for the last 1,000 years, that is what the heart is. Everybody's been talking about how the heart is the window to the soul. It is. So when we connect to it and we bring awareness to it, it connects us to this other piece of ourselves and awareness of that is really shifting who we are, how our body works, people's illnesses, and how they interact with each other. And I mean, that's really what we need to do. And I kind of look at medicine and how we're going down these roads of genetics and changing people's genes and the Human Genome Project and what that, where that went. And this whole idea of we're going to rid the world of disease because we understand genes. And I just have to laugh because until we can learn to treat each other better, it does not matter what we do with our genes, because epigenetics is going to just shift and turn things on and turn things off because we're exposed to the stress and how we're being treated and how parents are treating children and how we're treating each other and the exposure to domestic violence and the exposure to gang violence. And until we learn how to better get along, disease will never be eradicated, no matter how many amino acids you're able to change. And so I think part of this is really connecting to this other authentic self that's going to facilitate that real healing and helping people connect to that piece of themselves that's really going to do the healing for them.
Yes, imagine that you have high fever, and the family doctor visits you and checks your fever and blood pressure and prescribes a couple of pills and stays there with you for another 15-20 minutes and has a very honest conversation, skipping all the formalities that we usually have in small talks, and ask real life questions. And then you feel like, okay, here's the doctor I trust. You start really to open up and speak honestly, almost like confession to the priest, but without religion. Speak out your heart. That in itself might be healing, and that in itself might be healing, might give you relief, and might even bring up stuff that are related to the cause of the disease. So healing conversations, hearing relationships are very welcomed in the medical profession.
This has been a Heart-Based Medicine production. Thanks for listening.